What we've discovered in practices who have purchased an EMR now but had been using Elysium prior to their EMR purchase is that they like a lot of features in the Elysium product that maybe they don't really have in their current EMR, and it's particularly the way that clinical results are handled.
One of axolotl's true and probably least appreciated strengths is the ability to get data from a wide variety of different medical record systems, laboratory, emergency department, radiology systems, and convert it into normalized data that we can distribute. It's extremely important to us to be able to aggregate as much different disparate data as we can so that the physician has a single point of access to gather that data. In so doing, some systems prefer an architecture in which the physician has to query the system to determine if a particular information point is available.
Using an EMR is a lot of work for some of the offices and some of the doctors. I've heard figures of productivity in the doctor's office going down by 50% when they implement an EMR, simply because the data has to be input into the EMR before it's there for the doctor. Elysium went completely around this and got the information and presented it to the doctor. The office does not have to input that information.
Since we started using axolotl, we've grown from about 10,000 clinical messages per month to about 23,000 messages per month now. Part of that is due to the growth that we've had within our Franciscan Medical Group, but the other part is just growth in visits that we've had from our community physicians. One of the reasons that physicians like to refer patients to our hospital is because that they know that they're going to get those results back as soon as the tests are completed. So I think a lot of that has driven the volume into the hospitals.
What axolotl system does instead is within a few moments of when a clinical message is completed, whether it's a laboratory result, whether it's a discharge summary from the hospital, whether it's a radiology exam, a pathology report, that data is pushed to the physician. So they know they don't have to worry about pulling the data. They simply log into the system, and if it's there for them. They have confidence in it. It saves a great deal of non-productive telephone calls, non-productive follow-up. And from the laboratory and radiology department's perspective, they don't get the volume of incoming calls that they used to get because the physicians have confidence that the data, in fact, will be presented within just a few moments of completion. And that, from a workflow perspective, is one of the reasons we've achieved the adoption that we have.